Well, Matthew joins me now alongside Dr Hillary, and Matthew, a really important storyline, and it will save lives. It really will.
I absolutely hope so. Yeah, I mean, it's tonight that David actually gets that diagnosis of that it is actually cancer. Up until then, it could have been just any kind of lump, which it can be. A lot of cases are that it is just a lump and it's not cancer.
But you've got to get it checked.
He gets diagnosed, and from doing this, a lot of people on Twitter have said to me, if this saves one life, if one person checks themselves and finds a lump and goes to the doctors, then we've done our job properly.
And of course, you've got to get it right. You've absolutely got to get it right. You've got to do your research. You've got to make sure that it's, because it is so important.
Yeah, absolutely. And doing this campaign with you as well, I've met people through doing this campaign that I've spoken to that have really helped me with the storyline. The two guys that I was talking about earlier, which I think we're going to see on Thursday, the VT, that I think this is them there.
Yeah,
we
that's
went and played pool together.
Sure.
Alistair there, who's just talking now, he left it a year before he went to the doctors. He knew there was something wrong with his left testicle, and he left it a year, and it was his girlfriend at the time that said to him, listen, you need to go, there's something wrong, stop being male, stop having this bravado, not wanting to go to the doctors, it'll be fine. And he went and he had testicular cancer within, I think it was in 3-4 days, he had his testicle removed because it was that far advanced.
Because the thing is, if you catch it early, you know, that's the thing, the earlier you catch it, of course, the greater chance you have of overcoming it.
Yeah, absolutely, and that's what we're going to try and get over in this campaign, checking yourself. Dr Hillary will explain when it is best to check yourself, when you're warm, after a shower. If you check yourself, you find a lump, get straight to the doctors, because the earlier you catch it, the more treatable it is.
No, exactly. And I know that you know, obviously, when you've got a big storyline like this, you almost talk about it. You know, you're sitting having a cup of tea between takes. Yeah. I guess you must talk about it quite a lot.
Yeah, absolutely. I mean, it's a huge storyline for me to be given. Like, as an actor, it's absolutely brilliant to be given a storyline like this. And the fact that I can go on then and meet people that have been through this and have had testicles removed, have been through the chemo, which David's going to go through. It's been fantastic to ask them the questions like, how does it feel? How does it feel to be told that time you're told you've got cancer? How does that feel? How does it feel when you're having the chemo? What does it make you feel like? Are you poorly? This, that. So it's been brilliant to talk to people.
No, very much so. And you know what? I mean, we've been talking about this for a while. You know, Hillary, we've talked about this over the years a lot. But there's still... Yeah, well, we went out and asked because there's still a lot of, I don't know, people not... Yes, reluctance. Have a look at this.
Swollen testicles, isn't it? That's the sign, isn't it? Other than that, I don't honestly know.
I don't know at all, no. Pretty bad, I imagine.
Maybe aching? I don't know.
Lumps, maybe, yeah.
Not really.
Come back.
Pain, I don't know. Something like that,
The awareness is going to be there because I suppose that we don't know what we're looking for.
I wouldn't say I check, but I would definitely notice. Men not go to the doctors very often, I never heard of it.
Yeah, I probably would be embarrassed.
And I think sometimes the more you try to make them talk about it, the more embarrassed they get.
It's something what you think's in the future, you know what I mean? You think it'll never happen to you, sort of thing.
Right, there's confusion and there's embarrassment, and we have to stop it.
Isn't that strange? One guy's laughing.
I know.
Another guy's saying, well, you know, I wouldn't know what the symptoms are.
Don't know.
And it's the woman who's doing most of the talking.
Aha!
With her partner there. Unbelievable. Well, it's actually very believable.
So, well, this is the thing.
Let me first... I mean, Matthew's so knowledgeable. It's great. Absolutely great.
Brilliant.
And he's done his research, and that's really good. First thing to say is this is the most common cancer in young men aged between 15 and 49.
Right. It's
not common as a cancer, but because it affects younger men, it is the most common cancer in that age group, first thing. Second thing, catch it early, 98% cure rate.
Wow. Even
if it's been a year that you've noticed something wrong, as you said, and you haven't been to the doctors in that year. So go and see the doctor, that's the first thing. So what are the commonest signs and symptoms? First of all, a painless lump on one of the testicles. Doesn't usually affect both together. So a painless lump on the contour of the testicle itself, not the little tubes at the top or bottom or round the back. Right. On the testicle itself. Okay. So painless lump. Only 4% of those lumps will be cancerous, however, but go and get it checked. Second thing is likely to be a heaviness or a discomfort in the bull bag. I could say scrotum, a medical word, but I hate that word. So I say what patients say.
The ball bag in Scotland, yes.
No shame. Okay. Thirdly, an enlargement under the nipple or in the breast tissue itself due to the hormones released by the tumour. So some tenderness around the nipple area. Those three things are the most common symptoms that a man's likely to report. And if you get them, guys, for goodness sake, go and see the doctor, because the doctor's not going to be embarrassed. It's his bread and butter. He's going to sort you out. Either
He's seen them
reassure you,
before.
absolutely,
He's seen them before.
absolutely. And given the obsession that guys have with their bits, isn't it extraordinary that a quarter of men have never examined them properly?
Well, they're always playing with them. They're always fittering
well, there
around
you go.
themselves.
Men have always got their hands down the trousers,
I
and then you
know.
speak to a bloke and he goes, "No, I've never really checked myself." It just seems bizarre, doesn't it?
Yeah.
It's bizarre.
Honestly, it's crazy. So look, we're going to put it all.
change it.
We're going to put it all on the website, aren't we? We're going to put everything there. So don't forget to visit the website, where among lots of advice you'll find Dr. Hillary's potentially life-saving guide to self-examination. Are we talking about every day that they should be having a fitter?
No. I mean, and again, you don't need to obsessionally examine. It's just looking occasionally for anything that's out of the ordinary for you.
Right.
One's likely to hang lower than the other. One's likely to be bigger than the other all your life. But it's a new change that you haven't noticed before.
Gotcha.
If you notice that, go and see the doc.
Excellent. And indeed, women have got part to play as well,
Absolutely.
because they can check too. Thank you both.
Pleasure.
Great stuff. We'll see you really soon, because obviously we're going to be doing this for the next couple of days. Yeah.
Tune in.
As always, Emmerdale, 7 o'clock. Fantastic. Right.